Welcome to Module 2 of Fall Prevention in the Emergency Department. This module focuses on identifying fall risks among patients and understanding the factors that contribute to falls in emergency settings. We will explore patient-related and environmental risk factors, early warning signs, and real-world case scenarios to enhance our ability to recognize and mitigate fall risks. By increasing awareness and implementing appropriate interventions, we can improve patient safety and reduce fall-related injuries. Let's begin! In this module, we will focus on several key learning objectives. First, we will comprehend the global and local impact of falls, understanding how they affect patients and healthcare systems. Next, we will recognize at-risk populations, identifying individuals who are most vulnerable to falls. We will also explore the cascade of events following a fall, examining the consequences that unfold after an incident. Additionally, we will distinguish the different types and causes of falls, helping us understand the various risk factors involved. Finally, we will identify key risk factors associated with falls, ensuring we can take proactive measures for prevention. By the end of this module, you will have a deeper understanding of how to assess and mitigate fall risks effectively. Falls are a major global health concern. From a global perspective, falls are the second leading cause of unintentional injury deaths, resulting in 646,000 fatalities annually. Among adults aged 65 and above, 30% to 40% experience falls each year. Looking at the Malaysian context, 30,000 falls are reported annually, leading to 500 fatalities and 15,000 injuries in 2022. These trends indicate a growing burden in Malaysia's aging population, highlighting the urgent need for effective fall prevention strategies. Understanding these epidemiological trends allows us to better assess risk and implement preventive measures. There are three main types of falls: slips, trips, and spontaneous falls. Slips occur due to wet surfaces or inappropriate footwear, leading to a sudden loss of balance. Trips happen when a person encounters clutter or uneven flooring, causing them to lose their footing. Spontaneous falls result from medical conditions such as syncope, neurological impairments, or sudden dizziness, leading to an unanticipated loss of balance. Understanding these categories helps us identify specific risk factors and apply the right preventive measures to reduce falls. Falls can result in different levels of injury, ranging from no harm to life-threatening consequences. First, none. Some falls cause no visible injuries or symptoms. Next, minor injuries include bruises, abrasions, and require basic treatment, such as dressing, ice, or limb elevation. Moderate injuries may need sutures, skin glue, splints, or result in muscle or joint strain. Major injuries are more severe, requiring surgery, casting, or traction. These may also involve neurological or internal damage. Finally, the most severe outcome is death, where the injuries sustained lead to fatal consequences. According to the National Database of Nursing Quality Indicators, NDNQI, proper assessment and timely intervention are crucial in reducing the severity of fall-related injuries. Identifying fall risk early is crucial to preventing injuries and reducing healthcare burdens. First, high morbidity. Falls contribute to significant injuries and increased healthcare demands, requiring hospitalizations, rehabilitation, and long-term care. Second, increased mortality risk. Fall-related injuries are particularly dangerous among elderly patients, leading to complications that increase the risk of death. Lastly, economic burden. Falls result in rising healthcare costs, including hospital stays, surgeries, and long-term care dependency. By proactively identifying fall risks, we can prevent injuries, reduce hospitalizations, and improve patient outcomes. Falls can trigger a chain reaction of consequences that affect patients in multiple ways. First, the physical impact. Falls can result in fractures, head injuries, functional decline, and even death. These injuries can severely limit a patient's independence. Next, the psychological impact. The fear of falling can lead to reduced mobility and social isolation, as patients become hesitant to move or engage in daily activities. Finally, the economic impact. Falls often lead to prolonged hospital stays and an increased reliance on long-term care, placing a significant financial burden on both patients and healthcare systems. By understanding these far-reaching consequences, we can emphasize the importance of fall prevention in protecting both physical and mental well-being. Certain populations are more vulnerable to falls due to age, health conditions, or biological factors. First, the elderly. They are at higher risk due to muscle weakness, balance issues, and sensory decline, which affect their ability to stay stable and recover from a loss of balance. Next, at-risk patients. Those with a history of falls, impaired gait or balance, cognitive decline, multiple comorbidities, or those on multiple medications, polypharmacy, are more likely to experience falls. Lastly, gender differences. Women face a higher risk of falls and fractures due to osteoporosis, making them more susceptible to serious injuries. By identifying who is at risk, we can implement targeted interventions to prevent falls and reduce complications. Let's look at risk factors of falls. Falls are influenced by two main categories of risk factors: intrinsic and extrinsic. Intrinsic factors are related to an individual's physical or medical condition. These include age-related physiological changes, chronic health conditions, cognitive impairment, sensory deficits, and polypharmacy, which increases fall risk due to medication side effects like dizziness or drowsiness. Extrinsic factors are external environmental hazards that contribute to falls. These include slippery floors, poor lighting, unsafe footwear, inappropriate use of assistive devices, lack of safety equipment, and hazardous furniture or layouts that obstruct safe movement. Understanding both intrinsic and extrinsic risk factors helps us take proactive steps in fall prevention, ensuring a safer environment and better patient care. Intrinsic factors are patient-related conditions that increase the risk of falls. These factors directly affect physical and cognitive function, reducing mobility and balance. Chronic health issues such as diabetes can lead to peripheral neuropathy, reducing sensation in the feet and increasing instability. Parkinson's disease further contributes to fall risk due to tremors, rigidity, and postural instability, making it difficult to maintain balance. On the cognitive side, delirium, a sudden and temporary state of confusion due to infections or medications, can cause disorientation and poor coordination. Dementia, on the other hand, leads to a progressive decline in spatial awareness and judgment, making navigation and decision-making more difficult. These intrinsic factors weaken both physical and mental abilities, making individuals more susceptible to falls. Understanding these risks allows for early identification and intervention, reducing fall incidence in at-risk patients. Intrinsic factors are patient-related conditions that increase the risk of falls. These factors directly affect physical and cognitive function, reducing mobility and balance. Chronic health issues such as diabetes can lead to peripheral neuropathy, reducing sensation in the feet and increasing instability. Parkinson's disease further contributes to fall risk due to tremors, rigidity, and postural instability, making it difficult to maintain balance. On the cognitive side, delirium, a sudden and temporary state of confusion due to infections or medications, can cause disorientation and poor coordination. Dementia, on the other hand, leads to a progressive decline in spatial awareness and judgment, making navigation and decision-making more difficult. These intrinsic factors weaken both physical and mental abilities, making individuals more susceptible to falls. Understanding these risks allows for early identification and intervention, reducing fall incidence in at-risk patients. Early identification of fall risk is crucial in preventing serious injuries. Some key indicators include behavioral signs, such as patients holding onto walls or furniture for support and hesitant walking. Physical signs, like bruises or cuts, may suggest recent near falls. Proper documentation also plays a role. Instead of asking, "Have you fallen recently?" which may lead to underreporting, rephrase the question to, "Have you felt unsteady on your feet this week?" This approach helps identify potential fall risks even before an actual fall occurs. Environmental hazards are a major cause of falls, especially in high-risk areas within healthcare settings. Some common high-risk areas include wet floors in bathrooms or near sinks, low-lit corridors or examination rooms that reduce visibility, cluttered emergency department spaces with medical equipment, increasing the risk of tripping. By identifying and mitigating these hazards, we can create a safer environment and significantly reduce fall risks. To reduce fall risks, we must assess and address environmental hazards in patient care areas. Here's a safety checklist to follow. Is the patient's bed height adjustable to a safe level? Are walkways clear of equipment and cables? Are non-slip mats and proper footwear available? Is lighting appropriate and glare-free? Are assistive devices in good working condition? Regularly checking these factors can help create a safer environment for patients and prevent unnecessary falls. As we conclude this session on fall prevention in the emergency department, let's remember, patient safety is our top priority. Early identification of fall risks and timely interventions can significantly reduce injuries and improve patient outcomes. By applying the best practices, risk assessments, and interventions, we can enhance patient mobility, independence, and well-being. Thank you for your time and dedication to patient safety. Let's continue working together to create a safer healthcare environment for all.